Hello everyone. As I had told that during my this session of video, I'll be talking about semen morphology or sperm morphology. So sperm morphology, according to WHO manual, the reference value is 4%. Sperm morphology is coming to the structure of the sperm. So sperm's head should be oval shape and contour outer line must be there. So during sperm morphology or semen morphology, we use the stain, and there is a fixative and then stain A and stain B. So first a liquid sample is placed on the glass slide and then a smear is prepared. So once a smear is prepared, it is been kept for drying. Once it is completely dried, then fixative is been used. Fixative, it's like a spray. It is been sprayed on the slide and then it is dried again. So once it is completely dried, then stain A and stain B is used. After these stains, distilled water is used to wash the stain drop by drop, and then it is dried. Once it is dried completely, then it is being observed under the microscope using 45 lens of the microscope. Then we see the morphology of the sperm under the microscope. We see for the head defects, we see for the mid piece or the neck defects, then we see for the tail defects. So coming to head defects, so there is small head, pin head, pyriform head, and there are many other defects of the sperm head. Then coming to the neck defect or the mid piece defect, we see the bent neck, and coming to the tail defect, we see the coiled tail. So these are the defects which doesn't help in fertility. So these are the defects we identify, and then we count for 200 sperms. Then the calculation is done, and based on that the sperm morphology is been given. If there is 4% morphology, if everything is normal, then 4% is been given. If there are more defects, then less than 4% is been given. And coming to the vitality, vitality is nothing but if the movement or the motility of the sperm is less than 25%, the vitality test is been done. Vitality test, there are two types: HOS, that is hypoosmotic swelling test, then eosin-negrosin test. So one drop of the semen sample is been placed on the slide, then cover slip is placed on the slide, and it is observed under the microscope. Here what happens is the sperm which is broken already, that will absorb the stain. So when it absorbs, the sperm is called, it is not live, it is dead. So the sperm which doesn't take the stain in, it is live sperm. And coming to eosin-negrosin stain, the stain is being used, and as I have told you, HOS stain. So the semen sample is taken and the stain is being used, and here the background is clear to observe the live and the dead sperm. So the live sperm doesn't take in the stain, and the dead sperm that stains, it absorbs the stain. So the head region, we can see the pink color, and the background is purple color, and the stain and the sperm which doesn't absorb the stain, it is called live sperm. So this is about morphology and vitality.